Hi, I am Sagani Mejia, and today I'm going to demonstrate joint mobilizations of the hip, the knee, and the ankle. So for this particular assignment, I am going to perform 10 oscillations for 2 sets on all the joints, and in doing this procedure, make sure that the therapist is following the proper body mechanics, draping the patient properly so that you protect the patient's privacy, and make sure that you have a really good background on the convex and concave rule on all of the joints. So what we have here is a hypothetical 35-year-old female patient who sustained right lower extremity injuries, and after a series of surgeries on her leg, she has pain and limitation of motion on the hip, the knee, and the ankle joints. The patient has 3/10 pain on her hip with about 50% reduction on her hip extension, abduction, and internal rotation range of motion. The first thing that we're going to do is an anterior glide of the hip in order to increase extension. So the patient will be in a prone position, and then probably get a rolled towel if you don't have a mobilization wedge and put it on the distal part of the femur with one hand of the therapist holding on the knee area, and then the mobilizing hand will be on the proximal part of the femur right below where the right buttock is. So I'm going to perform a grade 4 anterior glide. So first I'm going to try to mobilize and see where the restriction is, and when I find the restriction, that is when I'm going to perform my grade 4 mobilization. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So grade 4 mobilizations are small amplitude oscillations at the limit of the available range well into the tissue resistance. So another alternate position for the anterior glide of the hip will be this way. The patient is on prone at the edge of the mat with the aid of the gait belt around the distal part of the femur, and with one hand from the therapist holding on the ankle area, and then the other hand is going to provide the anterior mobilization here. So I'm going to perform an anterior glide over here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So the next thing that we're going to do is a leg traction in order to facilitate inferior glide of the hip. So we're going to perform a grade 4 mobilization here. The patient will be in supine, and with the aid of the gait belt here to stabilize the upper body so that it will not move when I perform the traction motion on it. So the patient's leg will be in the resting position in order to get the most efficient inferior glide. So one hand will be on the proximal part of the lower leg, and then the other one will be on the distal part of the thigh or the femur. So I'm going to move it until I feel the resistance, and then that's where I'm going to perform my grade 4 mobilization. So up to resistance. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So this position, if it is not possible, especially for patients with knee problems like our hypothetical patient who had a knee surgery too with a 3/10 pain, the other alternate position will be placing the hip and the knee in 90 degrees, like so. And then I would personally just put her ankle on top of my shoulder. Some would prefer to put one hand on the distal part of the femur and one hand on the proximal part of the femur, but I would prefer to cap my hands and then put them as proximal as I can on the patient's femur, and then I would perform my inferior glide over there toward this way. So I'm going to perform my grade 4 post inferior glide. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Are you feeling okay?
Yeah.
Good. So the last mobilization that I'm going to perform for the hip is the posterior glide. So this type of mobilization is supposed to increase the patient's hip internal rotation. So have the patient in supine, well out to the edge of the bed, and then with the aid of the gait belt over here, holding on to the affected leg on the distal part of the femur, and with one hand supporting it so. You can also ask the patient to hug her other leg, and since our patient is young and high level, she can do that. So one hand will be over here where the mobilization will be happening. So I'm going to perform a posterior glide going this way. So when I get where the resistance is, that is when I'm going to perform my grade 4 mobilization. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So this grade 4 mobilization involves small oscillations in order to increase hip internal rotation. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now let's move on with the patient's knee. So the patient has 3/10 pain with knee flexion reduced to around 25%, and also her patellofemoral joint has limitations on her inferior and medial glides. So the first thing we're going to do here is a tibiofemoral posterior glide. So the patient is in supine, and I'm going to position her knee around 45 degrees over here, and then brace her leg using my upper thigh over here for stabilization, and I'm going to use my hands over here on the proximal part of the lower leg and perform a posterior glide, gliding the tibia posteriorly this way. So I'm going to perform a grade 4 mobilization here in order to increase knee flexion range of motion. So after determining where the restriction is, that is where I'm going to perform my grade 4. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So grade 4 is small amplitude oscillations at the limit of the available range. So an alternate position for the posterior glide of the tibiofemoral joint is having the patient still in supine with a rolled towel up here on the distal part of the femur, with one hand stabilizing on top of the distal part of the femur and one hand on the proximal part of the lower leg where the tibia is. So I'm going to perform a posterior glide to move the tibia posteriorly this way. Okay, so I'm going to perform a grade 4 over here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Next is the patellofemoral inferior glide. So I have the patient in supine and have a rolled towel under the patient's knee. The therapist's hands will be on top, on the superior part of the patella over here, and then with one hand with the thinner eminence over the superior part of the patella, and then with one hand supporting it as well to get a really good inferior glide. So look for where the restriction is, and when you find where the restriction is, that is where you're going to perform your grade 4 inferior glide. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So this glide is supposed to increase the inferior patellar mobility for efficient knee flexion. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So the last movement that we're going to perform here is the patellofemoral medial glide. So this glide is going to increase the patella's medial mobility. So we all know that the patella has a very important role in the biomechanics of the knee. So mobilizing the patella efficiently would really improve the knee's range of motion. So I would position the patient's leg this way. The patient is in supine with the rolled towel under the patient's knee. And I would prefer putting my hands this way, one on top of the knee and one on the inferior part of it. And then using my thumbs over here on the lateral part of the patella, I'm going to perform a medial glide going this way. So I'm going to push the patella inward or medially using my thumbs over here. So I'll get where the restriction is, and then I'm going to perform my grade 4 mobilization. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So I would perform another set. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Last is for the patient's ankle. So the patient is suffering from a 6/10 pain. So that's pretty painful in her situation. Aside from that, the patient has limitation of motion on her dorsiflexion, plantar flexion, and eversion, which are reduced by 50%. So since the patient has both pain and limitation of motion, I have decided to perform grade 2 mobilizations that are large amplitude motions within the range, not reaching the limit of the available range, and progress to grade 3 when pain is more tolerable. So the first thing that I'm going to perform on the ankle is the talocrural distraction. So this is being used for initial treatment, for pain control, and to improve the general mobility of the ankle. So the patient is in supine and have her leg supported by a gait belt over here for stabilization, and a rolled towel under here on top of her ankle. So my fingers will be here on the dorsal part of the patient's foot, and I'm going to perform distraction that is going this way towards me. So I'm going to try to release the talocrural joint. I'm going to perform grade 2 mobilizations, large amplitude, within the range, and this is for pain control. Okay, so it's right here. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So the movement will be this way. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So the next thing that I'm going to do is the talocrural posterior glide, and this is going to increase the patient's dorsiflexion. So we are going to maintain the patient's position this way in supine with a gait belt to stabilize the lower leg, and a roll towel on the distal part of the lower leg with the foot to the edge of the mat table. So the therapist's hand will stabilize on top of the ankle, and then the mobilizing hand will be on the foot, and I'm going to perform the posterior glide going this way. So I'm electing to perform a grade 3 mobilization, which is large amplitude oscillations up to the limit of the available range. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So this motion is going to increase the patient's dorsiflexion. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So the third one is the talocrural anterior glide to increase the patient's plantar flexion. So I'm going to perform a grade 3 mobilization here. So the patient will be in the prone position with the gait belt stabilizing the proximal part of the lower leg, and a roll towel on the distal part of the lower leg. So we are going to perform the anterior glide over here. So the therapist's hand will be on the dorsum part of the foot, and the other one will be on the heel, providing the anterior glide going this way. So I'm going to perform a grade 3 mobilization here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again, this motion is going to increase the patient's plantar flexion. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So the last thing that I'm going to do is the subtalar medial glide to increase eversion. So we are going to maintain the patient's position all throughout the ankle mobilizations. So I'm going to stabilize the patient's leg this way with my hand on top of the ankle, and one hand will be here on the heel area, and my movement will be going this way to the medial side to mobilize the subtalar joint medially. So I'm going to perform my grade 3 mobilization. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. An alternative position for the subtalar medial glide will be the patient would be on her side. For some people, this is a very difficult position, but for demonstration purposes, I'm going to show you how to do it. So have the patient stabilized using the gait belt on the proximal part of the lower leg, road towel on the distal part of the lower leg, and the therapist's hand on top of the distal part. So with the foot at the edge of the mat, I'm going to perform a medial glide going this way. So I'm going to perform a grade 3 mobilization. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So there goes my demonstration on the mobilizations for the hip, the knee, and the ankle. I thank Bethany and Ashley for the help, and I also would like to thank your time to watch and learn with my demonstrations. Thank you very much.